The topic is translating animal work to human research, experiencing from the lab. All you know, Dr. Saluja has worked so hard, and what we are having right now in pathophysiology of acute and chronic pancreatitis because of his work in last 30 years. Over to Dr. Saluja.
Thank you. Actually, I must apologize that we have the wrong title in the program, and when Dr. Thara and I talked a couple weeks back, we would like me to give a talk, more generic talk on how to become a scientist for this meeting, how to become a pancreatologist. So I'm going to tell you a little bit of my thoughts that how one developed to be a pancreas scientist, and then and I'll be open to your suggestions and questions. So, what are the building blocks to be a good pancreatologist? What do we need? And when I say pancreatologist, actually these are generic things. It's the same thing will apply to become a scientist of anything. So, to me, the most important thing is passion. You have to be passionate about what you're doing. One can argue that's important actually for everything in life. You have to be passionate. If you're taking care of patients, you're treating them, you have to be passionate about your patients. You have to be passionate about that. Only then you can think about making a difference. Although many times we get stuck with things. But if you feel you are stuck, being a scientist, being a pancreatologist, that means you don't have passion, then you cannot do that. Pick the area you want to work. Whatever you want to do in your life, but be passionate about that. And have patience. Research is very different in many ways than patient care. I've worked all my life in a surgery department. So I can tell you that in surgery department, let's say a patient comes in with a problem with gallbladder, right? Gallstones. You go in one afternoon, in a 30-minute surgery, you are out, 4 hours you are there, and your pain is gone. That's not going to happen in research. So as a surgeon, you will be, wow, I did something great today, right? And the patient will be very thankful and great. But in research, you need a lot of patience. It's going to be years, if you're lucky, before you can get something where you can be, wow, I did something, if at all. So you need to have a lot of passion, a lot of patience. But what else you need? Well, in this case, we are talking about pancreatitis, for example. I'll come to pancreatic cancer also. Why do we need to be passionate about that? Well, because the incidence of pancreatitis is increasing. In the last talk, we talked about this. In the US, there are more than 300,000 people every year. In the world over, there are millions. It costs billions and billions of dollars to treat them with no treatment. Incidence is increasing. It's true for pancreatitis. You know, I don't have the plot for pancreatic cancer, which is way bad. In the last 30 years in US, 40 years, the incidence of pancreatic cancer has doubled. Whereas the other cancers are going down, pancreatic cancer is going up. So if you want to pick an area, pancreas is very fertile because there's a need for you. So you could be passionate about an area where there's a need. And there's really no therapy for pancreatitis, and similarly true for pancreatic cancer, very limited opportunities for therapy in pancreatic cancer also. So what else we need? In order to be a successful pancreatologist, you need training. Training is really, really important. You cannot just say, okay, I finished my PhD, I finished my MBBS, and now I'm a pancreatologist. You need lots and lots of training. So for training, you need to join a well-established pancreatic research lab. Whether you're doing your doctoral, postdoctoral, or fellowship, or even a junior faculty for that matter, you need to join a group. You cannot just be an isolationist. You cannot just be in a silo that, okay, I know how to inject mice with cerulean and get pancreatitis, so I can open my lab now. That's not going to work. Even after you are trained, you have to continue doing things. You should pursue mini sabbaticals. Go to other places. Even when you have started your own lab, go to some other place for 2 weeks, 4 weeks, 6 weeks. I'll come to that there are opportunities available. Excuse me. Participate in workshops offered by professional societies and organizations. What else you need? You need a strong commitment. And commitment is a very, very interesting thing. So when you get a new job, and it's probably more true for clinicians than we PhDs, because we have nothing much but to do research, right? More or less, some teaching, some research. But if you're a clinician and you're passionate and you want to do a research, have a commitment from your employer, from your chair, from your dean, that you will have 50% of your time committed, paid for doing research where you don't have to bring patient revenue to get paid. That's very important. But equally important is your own commitment, that you will commit. If you're a clinician, half of your time, hell or heaven, you're going to do that. If you don't do it 1 week, 2 weeks, you're going to come back and do more in next week. Time commitment for protected time for research is very important. I know it's, as I gave you the example, that as a surgeon or as a gastroenterologist, you do ERCP or you do something and which there's a almost instant gratification. The patient will come and say thank you. Not only they will give money for your hospital or your practice, they'll bring you a gift. They will be very thankful to you. All of us do that. I do the same thing when a physician is there. But I think there's something Dr. Joe forgot to mention, that none of the mice ever come and say thank you for treating me, correct? So you should be committed working with mice even when they don't say thank you. So that's where the commitment comes. So what else should we? Actually, I think the most important part, and which I'm going to spend quite a bit of time, is mentoring, mentors. That's what's going to make a big difference to mentor and mentees. Actually, it's most essential to surround yourself with individuals who are already where you want to be, who are already doing what you want to do. Remember, iron sharpens iron. So that's the only way you do. But there's no formula to pick a good mentor. Actually, by and large, your success and failure in life will depend on getting a good mentor. So, how do you find a good mentor? Well, join a well-established pancreatic research group, just like I said earlier. Pursue mini sabbaticals. That's very important. And there are a lot of organizations. For example, I'm from American Pancreatic Association. I help them run. I'm secretary trader. We give. If you are interested in going and learning somewhere, anywhere in the world, as long as you're a member of APA, IAP or something, you and your mentor, We'll fund you for 1 month to go work somewhere. We'll pay your airfare, food, whatever you need. So make use of, and there are many other organizations which do that. Make use of those. So, and for mentors, mentoring is a key responsibility. So, a direct supervision may always not be the best. In fact, your boss may not be your best mentor because your boss has many other interests. So, obviously, he or she will be your mentor, but I think it's important to have multiple mentors. That really helps. There's nothing wrong with having a group of mentors. Some in your institution, some outside. If you are in a Vellore and you want to study pancreatitis, obviously there are several people here who could be your mentor. Dr. Thar could be a very good mentor, and so on the others, right? But it's good to have someone else. Maybe in Hyderabad, maybe in Delhi, maybe in Naipur. So you could have mentors there also, where you can meet with them. And that's what we encourage, that meet with them once or twice a year. Again, APA will fund that you go and meet with your mentor for 2 days, which is off-site mentors. So, it's very important to have one-on-one time. It's good to have Zoom meetings, but in-person meetings is what makes a difference. So you need to have a mentoring and mentoring is a reciprocal relationship. It's a two-way street. If you are not a good mentee, even a best mentor will not change. And if you're a great mentee and if your mentor doesn't pay attention to you, tough luck. So some of the questions mentees should have. What do you want out of your mentoring relationship? Set some goals for yourself. Long term, short term. Where you want to be. What's your focus? You need to know that, what your focus is. Then your mentor can help. How do you learn best? How do you like to be challenged? Unless you are challenged, you are not going to do something. How frequently you want to meet with mentor? You can't meet every day, particularly if your mentor, even I'm talking about on-site mentor, he's chair of biochemistry. You cannot just say that I'm going to meet with you twice a day or once a day. I mean, if he or she can meet you once a week, that's good enough. Have your questions, meet with them. And if you have some interesting ideas, your mentor will meet with you a lot more. So I have mentors and I have many mentees over my lifetime. The other part I want to tell is that mentors will half the time cancel their meetings if they are reasonably busy. Many of them will do 80% cancellations. Don't give up, don't get disheartened. That's part of life. So if your mentor does not show up or cancel, that's fine. Set up another meeting. Because mentors have other things in life also, more than you do. So, I'm not going to go all of that, but what does mentee need? And that's very important for mentors to know that how we can help mentee. And it's really important list. Mentees need support and guidance. You just don't tell them, do this experiment today, do that tomorrow, and then bring me the results and write a paper and I'll correct it and put my name and be done. No, they need guidance. They need feedback. They need opportunities to be challenged. We need to teach them tricks of the trade. They should be your partners in brainstorming and exchange ideas. Actually, I learned a lot more from my mentees than they learned from me over the years. You need to teach your mentees, presentation skills. I had probably in my lifetime 50 mentees from India or South Asia. And many of them, when they come in, they are unlike nowadays. 30, 20 years back, they were very shy, they will have hard time speaking. Not that they don't know how to, they're just very shy. Or when they give a talk, 20-minute talk, they will finish in 5 minutes. They speak so fast. So you have to show them how to give a good talk. That's a part of good mentor. I think one of the most important thing is you need to introduce your mentees to the other leaders in the field so that they get to know them, so they can be leaders eventually. So you need to provide opportunities, you need to show them grant writing skills, collaboration skills, and help them with clear directions. You have to choose your mentors very, very carefully. Short-term goals, long-term goal, give and receive feedback. If you're a mentee, never stop asking questions. But the next thing is most important, and most of us fail to do that we don't own up our mistakes. All of us, mentee, mentors, everyone make mistakes. Kids make mistakes, parents make mistakes. Husbands make a little more mistakes, but wives do too. So all of us need to, well, last is true though, right? That husbands always make more mistakes. But we need to learn from them. But you can only learn from your mistakes if you own up. If you don't even admit you made a mistake to yourself, I'm not talking about telling someone else, you will never learn, you will never change. Think about future collaborators. So work towards that. It's part of academic politics. Be part of it. So this is Dr. Peter Bank, who's a great guy and great pancreatologist. He wrote that mentorship is critical to the development of a new investigator, both in terms of research and career. Your goal is to make available to your mentees your accumulated knowledge and insights. Your expectation should be that your mentee, and it's very important, in their career will accomplish more than you have. That's a successful mentor. A mentor's best day should be when his mentee gives the lecture which a mentor has always given better than you. That is what's most satisfying to mentor. I dedicate my talk to my mentor, Dr. Michael Steer. You know, we collaborated for 20 years in Harvard Medical School in Boston. So mentoring is a very, very important component. Okay, what are the other building blocks? Ideas. If you want to be a pancreatologist, you need to have ideas. I hope I'm not taking way too long. Can I spend another 5-10 minutes? So, because I'll tell you how I developed some ideas. And ideas are logical things. It's not that you wake up one morning and then you say, okay, tomorrow I'm going to cure pancreatic cancer. It doesn't happen. It has to be very systematic. So I'll give you that how you need to pick a topic that genuinely interests you. Be specific. Avoid vague ideas. Narrow it to a manageable scope. Don't have just big, huge thing that I'm going to solve this tomorrow. Conduct a thorough literature review. That is very, very important. Participate in professional society meetings so you can listen to others and see where field is, what you need to learn, where you need to go. So I'm going to tell you my journey as an example of how I develop ideas. Obviously self-serving to tell your stuff, but since I'm not that smart to know everyone else, so I'm going to take my own example in this case. So I was in Bethesda, Harvard Medical School. I've been doing pancreatitis work at that time with Michael Steer, one picture I showed you. And you know, I didn't get paid that much, so I was always looking for a free lunch. I don't know if you guys, we go to seminars when there is a free lunch. And you guys should do that also. I mean, you know, free lunch is always a good thing. So there was a free lunch, and you know, one of my friends who was a cardiology researcher said, hey, come over, you know, listen to this talk at noon. So I go there. I have no interest in that area, in myocytes, you know, cardiac myocytes and nothing. I mean, pancreatic acid cells, those are the main thing. So I go there, and they're talking about heat stress in preconditioning. What they say that you should precondition increase heat stress that protects primary rat cardiac myocytes. Now you can say, what does that has to do with anything for pancreas? So I was just sitting there, and now since I was sitting there, I was listening while munching my pizza. So I had to say, wow, you know, diseases are very, very similar. What happened in cardiac myocytes? Similar thing probably happened in acinar cells. So they're talking about heat shock proteins. So I came back and I said, let's look at what heat shock proteins are. I didn't know that. And this is 1990s. It turns out that these proteins were discovered by a guy named Retosa. Very interesting story, for lack of time, that how he discovered this. Maybe sometime. So that's when we have a beer. That's when you talk about these stories, right? So, but very interesting, heat shock proteins are, it turns out that every living cell has that. And it's a very interesting function. There are many functions which turned out in time, but that time, and which applies to me, my interest was that whenever cells or we are stressed and pre-lethal stress, these proteins go way up and they prevent subsequent lethal injury. Lethal injury? Cells dying by necrosis, and you know, that's what they were talking about in there. I said, wow, in pancreatitis, acinar cells have necrosis, they die. How about if we increase HSPs in pancreas and see would these cells live? Okay, so with that thought, we say, okay, let's do some experiment. So we took some rats and elevated the core temperature to 42 degrees or 41 degrees just for 25 minutes and leave them alone next day. Next day, look at their pancreas, heat shock proteins were up as expected, just to prove that we can do the same thing. I say, okay, now we induce pancreatitis in them. And look at that. The green is, you know, hyperthermia, and you can see every parameter was decreased. So it's not only, and now getting that free pizza now got us to do these experiments, and these experiments changed my life. You say, okay, heat stress, when you increase body temperature, a million different things happen. So if you want to specify, it's okay, let's just make a transgenic mice with HSP70 so that you don't have to elevate body temperature. So we had transgenic mice. Indeed, transgenic mice which overexpress HSP70 had a much less pancreatitis. Same thing was inflammation in these. Pancreatic MPO was less, acinar cell necrosis was significantly less. So all of these experiments told us, and this was a very elegant work done by many people in the lab. These are the three key players who worked with us, or I worked with them, they were my mentees. And we have many beautiful publications in that HSP70 ameliorate pancreatic injury. So So now one can stop there and say, oh, great. But then if you think logically, next step, we thought pancreatic cancer. Now in pancreatic cancer, so in what's in pancreatitis? We want acinar cells to live, right? Not be necrotic. Now in cancer, we want cells to die. And pancreatic cancer cells refuse to die. And now that we have learned that heat shock proteins protect cells from death, we thought, okay, maybe it's time to see if cancer cells have high level of this supposedly good protein. And indeed, you look at that, we took 4 or 5 different cell lines, human pancreatic cancer cell lines, everyone had very high levels. You took some fresh from surgeons, tumor specimens, and normal margins. Indeed, tumors had much higher level of heat shock proteins. Then if that's the case, then it's okay. If we block heat shock proteins, then cancer cells should start dying, right? Simple logic. We use RNAi and those kind of things, genetic approaches, and indeed that's what happened. But we really needed an inhibitor. So that's how, you see, everything goes logical with time. When I went to that seminar, and right now what I'm showing is about 10 years old. Then you start looking for an inhibitor. There aren't many inhibitors for heat shock proteins. You try trial and error. So that's what life is in addition to literature and logic. So we found this compound, triptolide, which is part of a plant product which grows only and only in western China, a city Chengdu, beautiful city. And this structure. And this compound in China is used for, like we use in India, turmeric, except it's poisonous. So people boil it, make some tea. There are no clinical trials in China on that. Now they are doing few things, but more so for arthritis. It's anti-inflammatory, anti-everything. So we, Ali in the lab at that time, and with Marcus Lurch, there's the first paper we published in 2007, that triptolide inhibits heat shock proteins and kills tumor cells without affecting normal cells. Killing cells is very easy. You could put a drop of Chlorox or HCl, cells will die. But then normal cells will also die. So you need to have something a little more specific, and that turns out. We did then, Phoebe Phillips, who's now a professor in Australia, she did these experiments and showed that indeed it shrinks tumors. Then we wanted to see how life progressed. So we wanted to develop as a drug, obviously, once you have it. But for drug, it's something has to be soluble in aqueous, not in DMSO, not in 100% alcohol. So we modified that. We made a water-soluble prodrug of this, which we named Minelide. And we have several publications of Minelide. I started a company, which Mini Amrita Therapeutics, which licensed this compound. And we tried some, like in different cell lines, it's very, very effective. You can see when you don't give Minelide, saline, animals die, you give Minelide, they live. The problem, again, is that we did clinical trials, and the outcome is, not as great as one would, but it is still. Again, one of the problems here is what I was pointing out, that we use 6-week-old mice, right? Look at this. I mean, here is the mice which were given just saline, bad tumors. The ones which gave Minelide, great tumors. Based on these results, we did clinical trials. And it's a significant outcome that we see some protections in this. This is a waterfall plot, and those of you who are not oncologists may not know, waterfall plot is when the tumor burden decreases, these are the things. When it goes up, that means tumor is not decreased, it's actually progressive disease. most cancer drugs are by and large progressive disease, or stable disease is the best outcome. So based on these results, actually now, so we did that in pancreatic cancer, right? But phase 1 clinical trials, usually you do is more wide. So we did in all GI cancers. That's a very standard thing. And our best response was in a gastric cancer patient, not in a pancreatic cancer patient. So then we say, okay, let's see, that's how life takes you in research. So it's okay, fine. Gastric cancer is really as bad. So let's do a trial in gastric cancer, just 2 more minutes I'm done. And let's do a trial in gastric cancer. For that, we went to Korea, and that's where now we finished phase 1. Phase 2 is ongoing, where we have recruited about 10 patients in phase 2 in South Korea. So what's the next thing you need? You need publications to be able. And so that's publications, stay top of, stay on the topic of interest. Don't just change every day to different areas. Stay productive. You need a lot of money. For that, go public funding, government agencies get that, private funding, industry, philanthropic. There are a lot of ways you can get money for your research. You have to be innovative and persistent. When your grants are rejected, don't be disheartened. When your manuscripts are rejected, love rejection. Then submit again and again. I was going to talk about regulations for animal research, but Dr. Joe has described much better than I can, so I'm going to skip that. So the very last thing what you need is luck. So you work hard, you do all these things, and hopefully luck will bring you success. Thank you so much.